There's a now we're gonna start recording, huh? Why ACA? And we're gonna kind of just talk about what it actually is and how it started. So some of you guys might have been in the space when this started in 2010. I remember sitting in the office wondering like, Clay, what the heck are we going to do? We went out and recruited all these agents and did all this training, and we jumped in. We were a Medicare house before we really got into this space. And I remember the day that it launched in 2014, we were all excited. And then the website crashed 2 hours in, and we didn't know what was going to happen. And then there was, in the first year, carriers got out of the business, and then carriers said they weren't going to pay. Like it was wild. But what we found is we've we've rode these waves and these valleys, and we found that this isn't going anywhere. This is here to stay, no matter what anyone says. So the goals here for the ACA when it started was to just make insurance affordable for people under 65. Okay. It provided subsidies for people that were making anywhere from 100 to 400% of the federally poverty line. 2021, that got extended during COVID, and it looks like it's going to get pushed back, but we're waiting to hear exactly what's going to happen. But this also expanded the Medicaid program, covered all adults with income below 138. In a state like Illinois, that's a Medicaid expanded state. A state like North Carolina, that's a Medicaid expanded state. I'm in South Carolina. They actually didn't extend Medicaid. So for states like South Carolina and Texas and Florida and Georgia, southern states, a lot of them kept it at 100 to 150% of the federal poverty line, where we were able to sell to lower income 365 days out of the year. Okay. This is a great place for people that really need it and get it affordably. Okay. So just a brief history. I talked about 2010. It started in 2010, known as Obamacare. Like it or hate it, this thing is here to stay. In 2014, it hit the shelves, and then with a federal mandate, which was pretty wild there for a couple years. And then in 16, Trump took away the federal individual mandate. There's a couple states that still have individual mandates. I believe Illinois is one of them, maybe not, but California, I know it definitely does. This allowed for other things to be sold, like short-term medical and stuff like that. And it looks like longer periods of short-term medical is coming back. So that's a good thing as well. Um, um, a little bit more options for health insurance coming soon. So in 2021, ARPA, or the American Rescue Plan Act, this extended a lot of credits, tax credits, and subsidies to more Americans. Okay, people that are making over 400% of the federal poverty line. So it helps a family like me. I'm married with 4 kids. God has been good. It helps me out tremendously with my insurance costs as well. Okay. It also fixed the family glitch, and remember that term. And if you're sitting here taking notes, I'd write those 2 words down. Okay, those 2 words right there are going to be something that I'm going to talk about. And if I was an independent agent full time, that's all I'd be selling is understanding that part of this space with the family glitch. This glitch allowed dependents of employees to get health who got health care at work. This allowed them to potentially qualify for tax credits with the ACA. And we're going to go into that today. Okay. So in 2024, over 26 million people are now on the marketplace. And what we've really tried to focus on, and Cedric saw a little bit of today in Chicago, is the ICHRA and QSERA pieces of this, where this allows trained agents to enroll qualified employees on the ACA plans 12 months a year. Okay. And this is early adoption. Okay. Out of the 26 million people that are currently covered by the ACA, only about 300,000 people are on ICHRA. Okay. There is, I don't know, 120, 130 million people that are working for small businesses. This is a huge slab of our population that could be utilizing ICHRA. Okay. But understanding this is deep and complex, and Peak as an organization is on the forefront of a lot of that training. Okay. And we're going to go over a little bit today. So, why on earth do I want to sell ACA? Because you are literally walking on dollars. Okay. And I'm going to explain that. Okay. ACA is incredibly easy. Okay. It is an 18-second quote, it's an 8-minute enroll. I have quoted and enrolled somebody in line at a gas station in Fountain Inn, South Carolina. You ask where Fountain Inn, South Carolina is, it's actually where I'm standing right now. It's where I'm from, okay? You don't need to know where it is, okay? But it's a small town outside of Greenville, South Carolina, and I go see Miss Crystal every morning on Highway 14 and at the Safeway, and I get my Diet Mountain Dew because Diet Mountain Dew is my favorite thing on the face of the earth. And one day I walked in and she was having a rougher morning, and I said, hey, do they offer you guys health insurance? And she was like, no, 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 no. I was like, well, can I show you a quote? I did it on my phone. We talked about it, showed that there was a $0 plan in her zip code, and we were able to sign her up. And guess what? I've gotten more referrals out of that. Okay. So it is literally that easy. 18-second quote and 8-minute enroll. In some cases, for people who are actually on the marketplace already, most of the information's already there. It might cut you down to 4 or 5 minutes. Okay. 20 to 40% of those 26 million people are self-enrolled. They did it themselves. I come across people all the time. When I ask those questions, are you offered health insurance through your employer? They say no, and they say I already have health insurance. And I ask questions like, hey, who's your agent? And they'll tell you, I don't have an agent. I signed up myself. Okay. I get a big smile on my face because I know that I'm about to pick up some more business. Okay. Because I understand the value prop of why a client wants to work with an agent like me. Okay. Where's the hospital you're supposed to go to? What doctors are you supposed to see? I would love to take a look at your plan just to make sure you have the right plan. Would that be okay? It doesn't cost you anything. I'm a local guy. I want to come and help you. Okay. I come and see you every single day. Okay. We can market to anyone and everyone at any time. So this kind of goes hand in hand with that 20 to 40% who are self-enrolled. I was in Dallas, Texas a couple weeks doing the Health Revolution tour that Cedric got to see today. And there was a young gal was helping me set up the room, and she was an employee at the hotel that we were staying at, and she asked me what I we did, and I said I help save people money on their health insurance. And I just asked right after that, do they offer you guys health insurance? And she told me they were 1099s, and but she already had health insurance. And I said, I would love to make sure that you have the right one. Can I get your phone number? And we set up a call, and we made sure that she had the right plan. And guess what? I'm her agent of record now. Okay. It's just me asking the question. Okay. And showing the value of what I can do for her. Okay. She has a whole lot of family. She just moved from Arkansas. We made sure that her child was in on Medicaid, and her mom now is interested in working with me. These are simple questions that I'm asking. I'm not even trying to. I'm just asking, posing the question. So we can market to anyone and everyone. Okay. And millions of people are still unaware. Okay. What we want to do with this space is create an increasing income annuity. And what I mean by that is I want to build income that is residual. And I want to add to that every single month. Okay. Agents ask me all the time, what's a good goal for their first year? And I say 300. And they're like, golly, 300 is a lot. No, it's not. It's 5 a week. Okay. It's 5 a week. If I open my mouth and talk to people and tell people what I do, I'm going to get leads. Okay. Every single place that I go, whether it's a gas station, whether it's a grocery store, where it's a restaurant, where it's a coffee shop, I have opportunities to tell people about something they may not know. Okay. Remember, I just said millions are still unaware. Okay. I want to continually put myself in a position where I am the person that understands this more than anything. I get a lot of calls from people from church, people from the gym, people that I've come in contact with. And in some cases, I'm not able to help them, but they know that I know enough to point them in the right direction. Okay. And I receive a ton of referrals by just being that guy. Okay. Every single person that you come in contact with should eventually if you build some type of relationship, know exactly what you do. Okay. That should be written all over your face. Okay. Because you might not be able to help them, but I'm sure as the day is long, they have somebody in their life that you can help. Okay. So make sure people understand what you do. Okay. Plans do auto renew. That might be going away next year, but probably 10 or 15% of my book of business doesn't pick up the phone, doesn't return text messages, doesn't return emails. They renew every single year. Okay. That might be going away. It might not. We'll see in the coming months. Okay. ACA is great. It is the deepest, richest health coverage ever. There's no ifs, ands, or buts about this. Okay. It's guaranteed issued. There's no pre-existing limitations. There's no dollar amount to benefits. Okay. As of right now, we have some huge subsidies, a lot of premium tax credits out there available to make most insurance plans very affordable for most people. Okay. There are some narrow networks. There's no ifs, ands, or buts. And what I mean by that is HMOs and EPOs. Okay. There's some states that still have PPOs, but the reason why they're so narrow in some cases is that it helps cut costs. Okay. It truly does. Okay. Most of the people that are looking for individual health insurance on the marketplace are getting it because they want something in place for the worst day of their life. Okay. Take that line. Okay. We're looking for insurance for the worst day of their lives. They're healthy. They don't even, in some cases, don't even go to the doctor. This is an opportunity to show the value prop of why they want to work with an agent like us to help them find a doctor. Um, they need a premium that they can afford. They need a copay to see that doctor, and they need a copay for drugs. In most cases, those are the three things that people are looking at. So most people aren't married to their doctors. Okay. This isn't like a Medicare sale where the first thing does happens is Ethel brings out her two shoe boxes full of medications, and you're just like, oh my gosh, I'm going to be in formularies for the next 2 hours. That is not the case when it comes to ACA. Okay, I ask questions like, "Hey, are you pretty healthy? Is there any medications that you take? Let's take a look at those medications. Is there doctors you really need to see? Is there a plan that if it fits you financially, would it be okay if you went to other doctors? You don't have to take all this time to go through every single line. If they want to, by all means, absolutely. But in most cases, like I said, people need a premium they can afford. They need a copay to see the doctor, and they need a copay for their drugs. Okay. 50% of our sales are $0 premiums, which is bananas. Okay. That's a lot. Yeah, but I sell Medicare. Awesome. I want you to sell even more. Okay. Spouse in the house, the children, the grandchildren, your Medicare clients need this. Okay. Your Medicare clients already trust you with one of the biggest decisions they ever made in their entire life. You think they trust you with their kids and their grandkids? Absolutely, they will. Okay. If you guys have a Medicare book, I promise you, if you just let your Medicare book know that you take care of individuals, you're going to pick up business. Okay. There's no ifs, ands, or buts, and we can market to them all day long about health insurance. Okay. Stop giving away those ACA leads as referrals. If you do want to give them away, I'll give you my cell phone number and you can call me with all those referrals because it's too much stinking business. Okay. Make sure you're able to take care of that spouse who's 62 when that 65-year-old when the other spouse is turning 65. Okay. Make more money for yourself. Continue to increase that monthly income annuity. Okay. So David Postman's story, he's an agent in our office, a good friend of mine now. I actually went to elementary school with him, and I didn't realize that until about a year of working with him, which was kind of wild. It's kind of how God works with us. And he came to us to do ACA. Okay. And he learned ACA and he continued to sell it. And he was working in nonprofits and all this stuff. And what he found, he fell backwards because of the ACA business that he was writing into 50 Medicare sales his first year. Okay. He wasn't even trying. Okay. People were calling him, asking, well, do you do Medicare too? Because I have so and so and so and so and so and so. He wasn't even trying to sell Medicare, and his first AEP sold 50 extra ones. Wouldn't that be nice to have 50 extra Medicare sales a year? Heck yeah, it is. He's just there and willing. Okay. Yeah, but I sell life insurance. I know you guys all sell life insurance. Okay. Sweet. I want you to sell even more. Okay, it gets me hyped when life insurance agents are understand the value of what ACA can do for them. You save people money on their health premiums, you're going to sell more life insurance. There's no ifs, ands, or buts. Okay. Um, it just continues and continues to surprise me how much agents can do in the life space when they add ACA to it. Okay, it's much easier to talk about health insurance than life insurance. Okay, I can't even talk to my younger brothers about life insurance. Not to mention, cold calling people. So this is also going to allow you to gain a lot of attention to those high net worth business owners. Okay, if you're able to work with them on their health and maybe even work with their staff and saving money on their health insurance, you're going to build a relationship with these high earners that it's going to allow you to present stuff like IUL and more life insurance. Okay. So we want you to take advantage of this. Now, agency building, like Cedric said, I mean, this is our bread and butter. Okay. And I love getting in front of agents and talking about the value prop of it. But I also love to talk about my agents to agents that potentially want to partner with them. Okay. My schedule is as open as it can be to the agents I work with. I want to be an asset for you guys. Okay. So you don't have to do the selling of ACA to agents. Okay. What we're doing now. Okay. We do have unparalleled agent support. I need to update that number because we went over 900 last week. We're probably at 905 right now, which was great. This morning we were at 905. Uh, Over 900 agencies work with us, okay, because of our unparalleled agent support. I don't want to toot my own horn, but I'm pretty accessible to my agents. There's no ifs, ands, or buts. If you are on my calendar, I will be there, okay? And here's the difference in that. Like I said, I'm an agent too, okay? With a lot of FMOs, marketers in the position that I'm in are marketers. Okay. And they want to get sales, which is great. And that's a huge part of what we do. There's no ifs, ands, or buts. There has to be mutual profitability. The difference is I'm an agent and I have a book of business and I've been in this space for a long time and I've seen the good, the bad, and the ugly. Okay. And I want you to do the right things that we have done and also stay away from the wrong things we've done. Because trust me, we've not we haven't had a perfect record in everything. I mean, we feel like we've probably found every pirate in the Caribbean. We've been shot through so many times. But we handle the contracting, the commissions for you, okay? And we obviously have the best training in the industry. I love meeting with new agencies, especially new ones who have been in this space before, and I get to show them peak training. And there have been and each time I get told, man, I wish I had this when we started. I was like, yeah, absolutely. Okay. So special markets. Remember I talked about the family glitch. We're going to jump into this real quick. So the low income 12 months selling, it is a very, very specific space. And there is a whole lot of sharks and a whole lot of bad sharks in this space. Okay. This space, the low income is so filled with people that a lot of times, a lot of agents are just fighting over the same group. Okay. This group is very, very important. They deserve the attention that they need to make sure that they're making the right health insurance decisions for them. But there is a whole lot of people in this space, and we're all fighting for the same groups. Okay. There's other areas that are almost untouched, like the family glitch, like nonprofit selling, like ICRA and QSERA. Okay. So the family glitch, I told you I was going to tell you, we were going to talk about this. And me, like I said, as an agent, if I had more time, this is where I would focus. Okay. The basic idea for the family glitch that was fixed in 2021 was it made it very evidently clear in law that if an employee's dependents were offered insurance that was deemed unaffordable, they were able to come off of that employee plan and go onto the marketplace to receive subsidies. Okay. So this is a gigantic space. Okay. As you guys know, and I would start to talk about this to the people that you know, and also to maybe past clients and so on and so forth. asking questions like, "Hey, how affordable is your dependent coverage?" I have this huge group of people that I know that I never thought I could jump into purely because they received their health insurance through their employer. Okay. Every year on the year, we're seeing rates climb up higher and higher, 14, 15, 16, 18% year after year. Okay. Now, by law, employers have to offer employees, okay, affordable health insurance. And what I mean by affordable is a math equation, okay? It should be under 9.02%. Write that down, 9.02%. Okay. And 99.999% of the time, employers offer employees affordable health insurance. By law, they don't have to offer affordable health insurance to the employee's dependents. Okay. So a guy like me who's married with 4 kids, in most cases in that space, insurance is going to cost me anywhere from $2,000 to $2,500 a month in the group space. Okay. If I'm making over $200,000, I would be able to take my dependents off that plan and put them on the marketplace to receive subsidies. I'll give you a perfect example. Okay. A couple years ago, this client's been a client of mine now for 2 years. And there was a lot of gray area in the family glitch space. And it got solidified, like I said, in 2021. And she came to me through another client of mine. She had gotten a brand new job. It was the most money she ever had made, and she was the breadwinner in the family. And her husband and her 2 kids went on to the employer plan. Okay, she was making about $85,000 a year. It's the most money she ever made, and she got a bill for her health insurance and her family's health insurance, and it cost $1,500 a month. And what she realized after taking this job and starting that job, that she just took a pay cut because of the cost of her insurance. Okay. That's pretty daunting feeling. You change jobs hoping that you're going to make more money. And in this case, she was actually making less because of the insurance. Okay. Because $1,500 is over that 9.02%, I was able to take her husband and her 2 kids off, put them on an Ambetter plan in Nashville, Tennessee. Okay. And I think it was like 240 bucks, something like that. Her insurance was 200 bucks. Now their combined insurance was just under $500, and I was able to hand her back $1,000 of her income on a monthly basis. Okay. That's life altering stuff. Okay. So this gives us an opportunity to work in spaces that we thought we couldn't in the past because employees were getting their insurance through their employer. Okay. So start thinking. And I know you're already thinking, man, who do I know who gets their insurance through their employer? Okay. Start asking about that dependent. And what's great about this space, it's not even a selling opportunity in that we're just trying to educate employers. Okay. So say you find an employee who's getting crushed by insurance costs, you take them off, you keep the employee on the plan, but then you take the dependents off. Who's the first person that's going to call you when they find out that the dependents come off? Well, the owner's going to call you and say, "Hey, why on earth are you taking dependents off this insurance?" Okay. And I've seen this from a lot of my agents. They get phone calls from the owners of the businesses asking, "Why on earth are you doing this? I'm trying to help these employees." And you say, "Wait. I'm just trying to save them money, and I'm also trying to save you money." Okay. In most cases, employers are going to throw something at their dependents. Okay. Whether it's 10%, 20%, 50%, whatever it is, this is a space where you're going to be saving not only the employee money, but you're going to save the employer money. Do you think you're going to have more opportunities with that business moving forward? Heck yeah, you are. Okay. You're there to save the employer and the employee. So instead of going right to the gatekeeper, you're working from the ground up. Okay. If you're able to help small businesses in this space, you're going to have more opportunity long term to be able to see other people and help more dependents. And maybe eventually, and this is a great segue, introduce them to ICRA. Now, ICRA is a real hot topic right now, and it's a buzzword. I was just at Medicarians in Vegas this last week, and every single ACA guy that or gal that got up to speak, all they were talking about was ICHRA. Okay. Why? Because it's a hot topic, but also what we've seen is this administration is wanting to push more people onto the marketplace, but do it in a different way. Maybe not necessarily utilizing the subsidies. Okay. So it helps save money for the country, but also gives opportunity to employees to have more choices for their health insurance. Okay. In most cases, and in most states, actually, Illinois is not one of them, but in a lot of other states, there is a whole lot of counties that are trending in that full cost for ACA is already cheaper than traditional group health insurance. Okay. But I'm not even worried about that cost wise. What I'm worried about is two things. Okay. And these are the two talking points that I talk to small business owners about when it comes to ICHRA. Do you want to solidify your health insurance costs on a monthly basis moving forward? Yeah. Okay. Employers are used to 12, 13, 14, 16, 18% increases every single year. Okay. The health insurance cost for most small businesses is usually the second cost on that P&L sheet. If you can solidify that number year after year saying, hey, this is as much as you're going to pay for health insurance on a yearly basis, do you think you're going to get the attention of business owners? Heck yeah, you're going to get the attention of business owners. Okay. The other point of this is instead of having one, two, maybe three options for their health insurance, the employees can go pick whatever the heck they want to in the zip code they live in. Okay. This also helps for companies that might have people working in other states too. So they're right on the line of South Carolina and North Carolina. They have employees that live in North Carolina, but they work in South Carolina. This allows employees to pick the plan they need in North Carolina comparatively to a group plan where they'd have to have two separate group plans. Okay. Those 2 points right there is going to give you an opportunity to get in front of employers. Okay. And, for the people that are healthy and young that just need a plan for the worst day of their lives, they can pick the bronze plan. If it's a family of four who gets bumps and bruises and goes to the hospital every once in a while, they can pick the silver plan. For the older couple who's on this plan and staying on this plan purely because of the insurance that they are offered as an employee, if they want a gold plan, they can go and pick a gold plan. Okay. And in some cases, you might even be able to help employees retire early because if they go onto an ICHRA plan, they're going to have to go to Medicare. Okay. So you Medicare agents, not only are you going to have opportunities to sell more ACA and talk to the business owner about life policies, you're also going to be able to sell Medicare in this space. This is the early adoption. I want you guys to really focus on this. So in June, we're going to do 2-day boot camps in Dallas and we're going to do 2-day boot camp in Atlanta. Okay. I know all y'all are all over the place, but those are easy places to fly into. That's why we picked those two cities. And we're going to do a 2-day boot camp. Okay. There is a cost, there is contracting involved. Okay. Because we are truly the only FMO that we have found that is going to break down ICHRA at a granular uh, pace. Okay. We're going to go through every single bit of this thing on how to write it, how to sell it. And we've also developed a platform that allows you as the agents to write the business by yourself and also give you an opportunity to even add on to the per member per month. Okay. So I know I said a lot, and that probably is a second language to some of you guys. But the opportunity here is especially in the with some of the changes that this administration is proposing right now. This is a really cool opportunity to sell a whole lot of business outside of open enrollment. Okay. Nonprofit selling is a space where a lot of our internal agents really grabbed a hold of. We have 3 internal agents that have been in ministry in the past, but also education. We have an administrator. My one of my employees now was actually my principal in high school, which is hilarious. But he comes from a space that understands nonprofits A lot of the employees that work in this space are there because they love the work that they do, okay? Not necessarily the money that they're being made. And nonprofits are not in the insurance business, okay? And they're being crushed by the cost of it. And it hurts those nonprofits if they don't have an option to offer affordable health insurance to their employees. This is where we step in, okay? And we do a lot of business in that space, okay? So selling ACA to small businesses, like I said, okay, we sell year round. Don't be stuck just selling an OEP, okay? We want to sell businesses anywhere from 2 to 49. We do have options for those who want to sell to groups over 50. ICHRA and QSARA, we just went through that. We have the tools and we want to get you that second and third sale, okay? And we really want the employer to pay, okay? You're saving people and saving employers money on their health insurance costs and solidifying the bottom line on that cost. You think a little bit of that savings they'll take, they'll say, yeah, of course, we want to give dental and vision. Yeah, of course, we want to offer life insurance. Okay. It opens the door for that second and third sale. Okay. We make it easy. Peaktraining.com. I can't speak to it enough. A lot of you guys have been there. We have an agent care team for every single agent that comes and partners with you. I being your agent care team member, and we do have the agency support. So you are out there selling and recruiting, not worrying about the technical details. Okay. So on our website, you've probably seen this roadmap. Step one is the why ACA. Why do I need to be in this space? Why do I need to jump into it? Step two is our certified contract and enrollment platform. Step three is our ACA basics and some cash flow sales. Probably some stuff that you guys do separately from us, but we don't care. We want you guys to have an opportunity to sell more, even if you're not working with us. Step four, five, and six is our advanced training. This is for the Clay says all the time, the black robe ninja assassins. Okay, the ones that want to go out there and sell 1,000 policies a year. There is a contracting wall there. We want to make sure that we're partnered, that we have um, mutual profitability in this space. Everyone, it has to work for everybody. Okay, and we got to keep the lights on. So contracting is is essential to see steps four, five, and six. Okay. Like I said, we make it easy from the start. We have peak training. We go to peak training. We go to ACA under 65. I will tell you this, that ACA prep class, step 2A, if you're new to this space and you are starting to go through contracting, if you watch step 2A, you will know exactly what to do. If you're wanting to start a team of your own, okay, or you have a team of your own now, okay, you as a manager, all we want you to do is be able to point to where you need to go, okay? We've done all of the work for you, okay? You don't have to answer these questions. You just say, hey, go, step 2A. Hey, you're looking for a state-based exchange training. Yeah, that's step 2C, okay? So on and so forth, okay? So I wanted to show you guys this. This is the FFM versus state-based exchange. Okay, and some of you guys understand this, but sometimes this can be a different language to some. Okay, FFM stands for Federal Facilitated Marketplace. So for a guy like me, an agent in South Carolina, I have a license in South Carolina, North Carolina, Tennessee, Alabama, Florida, Georgia, Texas. Okay. All the blue states are federally facilitated marketplaces. So if I have a license in a blue state and I've taken the FFM training, I can sell in all of those states. Okay. The yellow states are state-based exchanges. They got cocky and thought they could do it better than the federal government. And in most cases, I'm a state guy, but I haven't really found a state-based exchange that has done it very well. Georgia's okay. Okay. I live right next to Georgia, so I have to sell in Georgia. There's no ifs, ands, or buts. What's great about Georgia is, yes, they do have their own state-based exchange. And yes, they have their own training. Okay. But it only takes about an hour. And you can write business on Health Sherpa if you're selling in Georgia. So that is a nice thing. But I'll tell you this, I went to school in Virginia. I have friends calling me from Virginia, and I've tried to help them as much as I can. But that state-based exchange is no joke. And that platform is a nightmare. Okay. So even if I show you all of this, because I know you guys probably have, licenses all across the country, and that's good. Just because you have the license doesn't necessarily mean that you need to be contracted in that state unless you're spending money in those states. Okay. the yellow states have their own training that you have to do every single year. Okay. FFM, you do it once a year. The first time it takes you 4 or 5 hours. There's actually a lot of really good information there. But the second year, it'll take you 45 minutes and it's a ten question survey. Okay. It's super duper easy. Okay. Colorado takes 19 hours to take that training. Okay. Goodness gracious. If you're not living in that state, stay away. I don't care if grandma or lives there or auntie, whoever. Okay. Tell them we'll point you in the right direction for the website, but there's no reason to do that unless you live there or unless you're spending a whole lot of money there. Okay. Kentucky makes a lot of sense because they do have a good platform and there's not a lot of agents. But Georgia, if you're in the South, and you work in the South, it's a great option state-based exchange wise. Okay. So what do we do now? Okay. We'd love for you to be a part of the team. Okay. Cedric's team, anybody's team. We want to be a part of it. Like I said earlier, God has been so good to us. And we are really, truly in a position where, it, it sounds crazy. We're not necessarily, um, like we don't necessarily need new agents. We're in a time in our organization where we're able to give time away and knowledge away. Um, we get a lot of enjoyment out of just bringing people on and giving them an opportunity to go out there and make life-changing financial gain. Okay. So if you do work with us, great. If you don't, that's okay too. We are a vested day one organization. Okay. And I get this question. I got it a couple times today. Well, what if I want to move somewhere? Well, you can do whatever the heck you want. If your upline says you can go, you can go. Okay. We're not in the business of holding anybody back because guess what? You know you better than I will ever know you. Okay. And if you believe that you need to do what's best for your business, I'll try my hardest to hold you back, but this is your business. Okay? If we will forever pay the commissions that you have earned if you keep your license in place. Okay. So say you go out and sell 2,000 ACA policies in the next year, and you decide, guess what? 6 months out of the year, I live in Bora Bora. I just need the address to tell me where to send the check. Okay. We're gonna keep sending you the checks. There's no ifs, ands, or buts. Okay. So peaktraining.com is obviously our flagship. ACA Clay is where we do a lot of the meetings and stuff like that. And yeah, that's about it. Does anybody have any questions? We'll open the floor. And we got plenty of time. We got 16 minutes. Anybody? Everybody understands ACA from top to bottom.
I have a question.
Yes, ma'am.
Okay, you said that Texas is one of those states you can sell in any of the blue states.
Hmm.
You have to have license in each state or just contracting in each state. If you have
Yep.
license in Texas, my license in Texas,
Hmm.
so I need to be licensed in those other states as well, or just contracted for ACA in those
Yeah.
states.
That's a great question. You will need a license for those states.
Okay,
Okay. And to be honest
gotcha.
with you, Texas is big enough. You might not need licenses. I'll tell you this, I live in South Carolina. I have more business in Texas than I do in Georgia, Florida, and North Carolina combined. Okay. A lot of business in South Carolina, but Texas is a hotbed. Okay. And if you are good at talking to people for crying out loud, you're going to pick up a whole lot of referrals in this space. I've found little pockets in Dallas and in Houston and San Antonio where I'm just asking for referrals from the people I help. Okay. So continue to press on in Texas. There's more people moving to that state than any other state in the United States. So
Yeah,
um, Texas might be all you need.
good job. Thank you.
You're welcome. Anyone else?
And we had a large group that had a chance to hear some of the questions, so we're doubling back. We got some good stuff where we're taking it all in. So anybody, if you got questions, this is the one of our main contacts that's going to answer those big questions for you to get you where you want to be. So if you
Yeah.
if you got questions, now's the time to definitely ask.
Yeah,
I have a
and
question.
here's this as well. And guys, if you want contracting, your contracting link right here, this is the contracting link. This is the email address and the phone number. You guys already know this because you work with them already. But here's the thing too, and I'll put my email address in the chat, so you guys have it, or you can get it from Cedric. My calendar is always open. Okay, in some cases, it's a little busier than others, like today. But I want to be a true asset for you guys. Okay. So if you don't think of any questions, that's quite all right too. Just write them down if they come to your head, and you can go ahead and email me and jump on my calendar. Lori, you have a question?
Yes, and I just went blank on what I was going to ask you.
Hmm.
Um, sorry. I
No, you
I
don't have to
totally went blank because I was
apologize. I do it all the
multitasking.
time.
Oh
Yeah, it's a
yes,
long day.
appointing, full appointing. Have there been any change? I know I spoke with you like a year ago and
Yeah.
I was fully appointed at that time, but are there any like new recent changes within the last 12 months that we need to look for to ensure that we are still like
What's
compliant?
the, go ahead and email me and we can talk about that directly. There's probably a couple carriers that may be added to your state. Where are you located, Lori?
Illinois.
Yeah, I don't think anything. I think antidote. No, no, not antidote. Quartz came to Illinois. That's a great segue in that it might be a small carrier, but you can get into open enrollment and realize, oh no, I don't have this, and this is the only thing that works for this one person that is asking for health insurance. It happened to me in Texas this last year. I had a client of mine who's worked with me for the last couple of years. Of course, he waited till December 13th to get back to me, and he was just like, "Oh, I want the same thing." And I said, oh, "Okay, that's fine." I pull it up, and guess what? That plan is no longer available in his zip code. And I had to call him back, and we figured out, well, Anthem WellPoint's the best option for him. I have 2 days to get contracted. I'm being a hypocrite when I say, "Hey, have every arrow in your quiver." Luckily, I was able to get it, but this is the time where you want to put yourself in a position that everything's in place. So when open enrollment comes or AEP comes, we're ready to just rock. Okay. So that's a great question. You can reach out to me and I can double check if you're missing it. Quartz is a new one, but again, year to year, we never know what's going to hit. Okay. Blue Cross might be this year. Aetna might be this year. We never really know until a week before open enrollment starts. Okay. But we can talk about it. Marquita.
Hello, Dave.
Hey.
Got a question.
Yes, ma'am.
As far as how you said about helping nonprofits,
Hmm.
is there a certain, I guess, way to enroll nonprofits? Are we doing that more on the group side? Are we doing that as an individual?
Yeah.
Um, yeah.
Yeah, that's a great question. It really depends on size. There's so many variables in this space. And again, this isn't for the weak of heart in that, like, hey, let's go talk to uh, small businesses, and I've never wrote a ACA plan in my life. There's certain things you want to be able to know that you know how to work in this space. And there's a lot of variables in something like nonprofit because size of the group is huge, incomes of the group is huge. Okay. A group that's pushing 25, 30 employees, there's a different way in going at them comparatively to a small nonprofit that's 5 to 10. Okay. If it's 5 to 10, I'm walking in there and writing business. Okay. And maybe not writing it immediately, maybe setting up for open enrollment the next year, but I'm already sowing the seed of, hey, I'm your guy. I can take care of you come open enrollment. Okay. Yes, you could do the traditional group. Okay. But it's going to cost an arm and a leg, which is not what you want to be doing in that space. You could utilize ICRA in some of those cases, but most people that are working for nonprofits, this isn't always the case, but in most cases, can utilize subsidies that month. Okay. At least for the time being. So just continue to ask the questions. If you come across a group, guys, I get this all the time. People send me emails and we get on the calendar and we talk about certain groups because I've seen the good and the bad, the ugly in these groups too. I do have answers. And if I don't have answers, I have agents that can give me answers. Okay. Um, we do have something on peaktraining.com, and I'm going to see if I can show this real quick. This is my, can you guys see this part of my, can you guys see it?
We
No.
still see the awesome logo
Yeah,
that's on the screen.
that we can definitely see the awesome logo. Peaktraining.com. This is not what you want to see. Peaktraining.com. Can I type? It's almost 9 o'clock. If I go to ACA under 65, this is a nice little piece that we just added. You guys are all familiar with ChatGPT. We have developed a ChatGPT agent, AI agent, that is specifically for ACA. Okay, ACA answers. I can type in whatever I want. What is an income limit on ACA subsidies? Bang, there it is. I can't tell you how cheap information is in this space now. Okay, for with stuff like this. Okay, this is on our website, and John Evans, who's one of our marketers, developed this specifically for ACA. Okay, so in groups, asking questions about that kind of stuff and how it utilizes. How can I sell a group ACA plans outside of open enrollment with a group from 5 to 10? You're going to get more information. Okay. So I'm an asset. Something like this is an asset as well. Okay. Lori, did you have another question?
Yeah, and I was just gonna try it out when you brought that up with the Chat GPT. But my question is like when you're setting up a group, like say you have a small business,
Mhm.
maybe they've got 8 to 10 employees, for example.
Mhm.
How do you implement like your fee? I know today when we had the tour, we talked
Yeah.
about a fee for the agent. How do you
Yeah.
like word that?
Exactly. That is a question for another time and another place, and I'd love to answer it. It's just it goes a little bit deeper, and we're going to be talking about that in our boot camps, and we're also going to record all of those. So even people that weren't able to make our boot camps, we're going to record it and give you guys access to it if you're fully appointed. I think there will be some type of cost, but the cost isn't for us to make any money. We want to invest, we want you guys investing into yourselves, but also it makes agents actually do the work if we put money up against it. You know what I mean? And it'll be a nominal fee, but we're going to go through it, like I said, granularly and answer those questions. So the platform that you guys saw, uh, 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 Performance HRA, we're still in the process of solidifying some of those pieces, but it's going to be built into the system that is in place. Okay. So there's a cost to utilize an ICRA platform, which this platform is going to be $10 per member. Okay. Or excuse me, $10 per family. Okay. That is on the way low end of the cost for it. And on the other side of it, you're going to be able to add your fee, whether it's $5, whether it's $10. It's going to add to your member per month. Okay. So our platform sets all that up. Okay. And great questions. It's just like 10 feet deep into all of it.
Well, thank you.
Oh, cool. Well, guys, if you guys don't have any more questions, again, like I
Hey,
said,
Dave.
yes, ma'am.
I was just wondering, can you post your email address in the chat
Yeah,
again? I don't see anything.
I know I wasn't able to. Let me see if I can.
Thank
Uh,
you.
I I'm not a Zoom guy, so here I gotta just stop. Oh, there we go. There's the chat. And is there any questions? Okay, there we go. Dave S at ppisales.info. Send me an email and I'll send you my calendar back. Again, what the good thing about what is happening at Peak is a lot of people are coming to you, but the fact of the matter is I only have, 8, 9 hours out of the day. And I'm tough to get onto the phone. Okay. So if you're on my calendar, I'm going to show up. There's no ifs, ands, or buts. Okay. Even at 8 o'clock at night sometimes. I'd love to help as much as I can. So yeah. Anything
Let me
else?
ask you candidly, Dave. With some of the state-based exchanges,
Mhm.
I have a friend